Okay, good evening, everyone, and welcome to the Food for Heart Masterclass. In this masterclass, we are going to be learning the clinically approved, a science-based way, and also the most effective means for you to prevent heart disease or even reverse it without having to depend on medications, okay? Now, I'm guessing for a lot of you, this is not your first class on this topic. The first thing I want to mention is that if you have failed at being at your best health or helping your heart, then it's not your fault, because there is a lot of information out there and it can be confusing, honestly. Many times, all the information overload from Facebook and YouTube and WhatsApp broadcast messages can keep you from success because it's one new thing that doesn't work after the other. So if you have been concerned in the past that you can never get better or you can never get off your medications or even reduce your medications for a start, I want you to put all of those fears to rest. You can do this. You just need the right person to explain things to you. The big pharmaceutical companies and corporations want you to think that you need to solely depend on your medications every single day to make sure that you don't die from diseases like high blood pressure, high cholesterol, obesity, diabetes, which in turn, all of these things lead to heart disease, right? But I'm here to tell you that they are wrong. They have their own reasons for wanting you to think that, but it's not true. So if you've ever thought that some of these corporations want you to remain sick so that, you can keep buying medications, then you're probably right. Okay, they don't benefit from you being well and you being active, and they make billions selling medications that would relieve you in the short term. With consistent use, it would weaken your immune system and reduce your quality of life, which would make you look for medications over again, right? So it's important that they make sure that you are always in need of drugs all the time. Let's not even start with the experts on social media that would mix all manner of herbs and solutions and states that it's the 100% cure to your problem without any scientific backup or clinical approval showing that that specific product can meet your need. Okay, some people don't even know the content of the products. All right, so the difference with this class is that you are going to learn first off, and with learning, you can then make an informed decision for yourself. Okay, because what we are going to discuss today is actually very serious information. Okay, the fact that they call high blood pressure, high cholesterol, diabetes, etc. The reason they call all these diseases silent killers is because they can lead to devastating conditions like a heart disease. Okay, and that's what we're going to cover in this class. How can you prevent and how can you reverse heart disease? How can you also prevent things like you suffering a stroke or a kidney failure or a liver failure? Because many families every day are losing their loved ones due to cardiovascular diseases, right? And this is something that is very preventable and something that is also reversible. So I care about your success and I truly want to see you live the life of your dreams. And that's what we are here for today. How can I help you improve your health, your life, and most importantly, how can I help you prevent the occurrence of developing a heart disease or ever suffering a heart attack? Okay, so I want to show you how to get this done in this class today. All right, and I want to state again, if you don't have a pen and paper, please get one because I'm going to be giving you quite a lot of information today, okay? And some of you would need to take notes. All right, so why should you stick around? Today is going to mark a new day for your health and for your life. I'm going to be explaining how your heart works, what your heart is capable of, I would also share with you what research says about preventing and about reversing heart disease, okay? I'm going to expose some of the heart myths that prevent people from reaching the truth, and I will also share with you 10 key breakthroughs that can help you protect your heart and keep it vital regardless of your age, all right? And I would also show you how you can implement and put all these things into practice And I also have a free gift for you if you stay to the very end of this masterclass. Okay. All right. So in the next 90 minutes, my goal is to get you to believe that there are certain diet and lifestyle practices, okay, that are the key to unlocking a life that is free from suffering heart disease, a heart failure, or a heart attack. And in this 90 minutes, I would show you my framework that would make it very simple and very easy for you to achieve that result. Okay. So a few years ago, I came home to my hypertensive dad suffering a stroke. Now, I am the first child of my family. And when I heard that he had suffered a stroke, I quickly went into survival mode, right? Because like most African homes, my dad is the breadwinner of the family. And my dad had been hypertensive for 20 good years, if not more. Now, I was in school when he suffered this stroke, but they didn't tell me until I got home. I was having exams that period. It was December. So I was having a lot of important exams to take because I'm a medical student. So they didn't tell me, so that I won't be thrown off balance. But when I saw him, my question was, how come? Okay, because I know that he's hypertensive for the longest time, but I also know that my dad is very consistent with his medications. He takes Exforge on his table every single day. Okay, so how come? How is it that someone who is on drugs every day for over 20 years will still suffer from the very thing that the drug is supposed to prevent, right? And I decided that I wasn't going to wait until I became a medical doctor, because that's what I'm in training for. That's what I'm going to medical school for, right? I decided that I wasn't going to wait until I get my degree before I can think of and research ways that I can help my dad. Okay. So again, my name is Rita. I'm a medical student. I'm a wellness consultant, and I am your host for the day. Okay. So my dad told me in his words that his drugs kept him obese, it kept him tired, and it also kept him almost immobile. Okay. So at that point when my dad suffered a stroke, I decided that it was time for me to think of ways that I can help my dad, because clearly the path of him just depending on his medications was not the best. And it was also not the surest option, right? And I didn't want to lose my dad. Okay. So he told me a lot of things concerning the side effects of his medications. Okay. And with the stroke, it left him partially paralyzed as well during that period. Okay. Now, thankfully, in school, we had a 16-week research project, and I was asked to choose one medical condition, and I would research extensively over a period of 16 weeks for a treatment option for that condition. Okay. And I chose stroke because that's what my dad was struggling with, right? But over time, I have realized that stroke and heart disease is our topic for today, right? So I realized that stroke and heart disease kind of have the same mechanism. Okay. And what I've realized is that nobody simply suffers from a heart disease or a heart failure or a heart attack. You need to first of all be at risk for it before you then suffer a heart attack, a stroke, or a heart failure. Okay. So you need to either be suffering from things like high blood pressure, like diabetes, kidney failure, before you can then, experience something like a heart attack or a heart disease, regardless of whether you know that you are suffering from these risk factors or not. Okay. And since you have to be at risk in order for you to suffer from a heart disease, then the only way for you to prevent or to reverse a heart condition is to free yourself from whatever it is that is keeping you at risk, right? So if high blood pressure is keeping you at risk for a heart disease, the only way for you to prevent that heart disease from ever coming is for you to do away with your hypertension, or to control your hypertension, or to control your diabetes, right? So what I'm going to be sharing with you today is a science-based and a medically approved framework. Okay, I am not just coming up with these things on my own, or, because I feel like it, or because I think that's what it's supposed to be. What I'm sharing with you are simply facts. Okay, and they are all backed up by science and medical journals, and it's a clinically approved framework, okay, that would help you adopt certain lifestyle and diet changes that would help you prevent the occurrence of a heart disease, of a heart attack, or of a stroke, because they all have the same cause. They all have the same mechanism, okay? So by doing this, I was able to give my dad a second chance, at health. He's much happier now. He's doing so much better. And I'm very proud of myself for making that commitment to him. And over the past year, I've also been able to help other people in my audience as well. I have an audience of about 4,000 people that I usually communicate to from time to time, and that I usually lecture from time to time. Okay, so let's get into our topic for today. Now, as I said earlier, what can cause heart disease? If you ever suffer a heart disease or a heart attack or a heart failure, it's simply because you are at risk for it. So what is going to put you at risk for a heart disease is simply your lifestyle choices, okay? You being obese can put you at risk. You having high blood pressure, you not exercising, you not moving around, you having diabetes, you not eating healthy, you drinking all the time, smoking all the time, and also your age and your race can also play a role in the development of heart disease, okay? Now, the major question we should be asking ourselves is, what is heart disease? Now, heart disease is short for coronary heart disease. Now, what is coronary? Now, if you look at this diagram of the heart on my screen, you would see this blue pointer, okay? So this is your heart right here. And here, if you watch my pointer, you would see these blood vessels. They are called the coronary arteries. Now, everyone knows that your heart is what pumps blood through your entire body system, right? But your heart itself is an organ, and your heart also needs blood itself. So as your heart is pumping to every other part of your body, these coronary arteries are what is going to supply blood to your heart itself, okay? Now, you suffer from a heart disease when these arteries here, when these arteries are unable to deliver oxygen-rich blood to your heart. In other words, when these arteries are unable to get blood to your heart itself. Now, this is usually due to something that we call plaque. And plaque is a big word for cholesterol deposits that are in your blood vessel. Now, these deposits will kind of clump together and they would obstruct blood flow in your coronary arteries, which are the blood vessels that supply your heart with blood, okay? Now, this can either prevent blood flow to your heart partially, or it can prevent blood flow to your heart totally. Now, when it prevents it totally or partially, two things can happen. You can either suffer a cardiac arrest where your heart stops working completely, okay? Or you can suffer a heart attack where your heart is not getting enough blood, okay? So improper lifestyle habits form what we call plaque in the blood vessel, all right? And this is simply a representation of plaque. You can see this yellowish substance in one of the coronary arteries that is supplying blood to the heart itself, okay? So improper lifestyle habits form plaque in your blood vessel, which can lead to a coronary heart disease, or in short, a heart disease, okay? Now, what forms this plaque? Like I said, it's simply a combination of cholesterol and some other things like some fatty substances, some calcium products, some waste products, some fibrin, okay? And what happens is that it thickens your arteries. It makes your arteries very stiff, okay? And when it makes your arteries stiff, your arteries are unable to push blood forward, okay? And it can also break open that blood vessel, causing what we call a blood clot, okay? Now, I hope that this is not sounding too much for you. So what I'm going to do now is to play a very short video that would explain this, okay, in detail. So I hope that we can all see the video. So I want us to watch this together. So we are getting into one of these coronary arteries in the heart now, okay? So let's dive into this artery. Now, over the years, as you are in your 10s, your 20s, your 30s, your 40s, and you are eating without caution, you are not living a very good life, okay, in terms of your lifestyle habits, okay, and different things happen to you. These deposits can build up in your blood vessel, okay, these cholesterol deposits, okay, that we call plaque. Now we can see that it just keeps growing as you are getting older and older and older, and you don't even realize that something like this is building up within you, okay? So everything is fine, it keeps building up, but then all of a sudden, what happens is that it's too much. The tension in this part of your blood vessel is too much to the point where your blood vessel opens up. Okay, so we're going to say it's break open right now. Can you see that? And then you have cholesterol in the blood. Okay, so what's going to happen? Your body being so smart would then come to the rescue. Your white blood cells will come to the rescue. Your platelets would come to the rescue, and they will close up that area. Okay, so you can see your white blood cells acting, all right, trying to cover up that place. But then what's happening is that you can see that the diameter of this blood vessel has greatly reduced. You can see that blood flow is beginning to get obstructed, okay? So you can see that it's not as wide as it's supposed to be. Hello? Tosin says she can't hear me. Is it the same for everyone, please? Please let me know so I know that I'm not talking to myself. Can anyone hear me? I think I'm audible. Okay. Okay. So Tosin, I think the problem is from you. All right, so let's move on, okay? So we can see that it's obstructing blood flow. This plaque is obstructing blood flow, and the blood clot is also adding to it, right? Now, here's what happens in your heart itself, okay? So as all of this is going on, blood flow is being obstructed, and then you can see in one of the coronary arteries of the heart, you can see what's going to happen is that it will start to die, okay? And when this coronary artery, you can see it's gradually turning black. When this coronary artery starts to die, it means that your heart is now getting less blood. And it means that when your heart is getting less blood, that means that your heart is also getting less oxygen, less nutrients that your heart needs to function properly, okay? And this, in short, is what we call heart disease. Now, when it gets to a point where you have very little coronary arteries that are still alive, okay, that's when we say that somebody has suffered a heart attack. Okay, when it gets too much and your heart is struggling, okay, and somebody, gets that intense pain in the heart, that's what we regard as a heart attack. But way before a person would suffer a heart attack, this is what is already going on in the heart, okay, and this is what we are trying to learn how we can prevent and how we can also, reverse. All right, so let's move on. Now, Dr. Dean Ornish and Dr. Mimi Gorano, they conducted a study, okay? And their study shows that 4 out of 5 cases of this plaque formation can be reversed using diet, exercise, meditation, and group support, okay? And the truth of the matter is that as you are trying to deal with this plaque formation, you are simultaneously dealing with your high blood pressure and your diabetes. Now, even though diabetes has to do with your blood sugar, what is going to make your blood vessel to even open up in the first place is because of high blood sugar moving around in your blood vessel. That is what is going to make the walls of your blood vessel so brittle that it can't even handle the tension anymore, okay? So your high blood sugar is what is going to cause even this cholesterol to stick to your blood vessel in the first place. So you can see that as you are trying to reverse this plaque formation, just as Dr. Dean and Dr. Mimi did in their study, as you are trying to reverse this plaque formation, you are actually dealing with your high blood pressure and your diabetes. Okay, so it's like you are using one stone to kill two birds. All right. Now, when people hear that diet and their lifestyle choices can prevent and reverse this plaque formation, there are a few limiting beliefs. Okay, so let us get through those limiting beliefs right now. The first one that we have majorly is, I'm too old for this, or high blood pressure runs in my family, it's in my genes, etc. Okay, now John Hopkins School of Medicine, it conducted a study of 6,000 people that were aged from 44 to age 84. And all of them had this plaque formation in their arteries. Okay. Now, this study showed that people who adopted a healthy lifestyle reduced their risk of death by 50% in 7 years. Okay, so if someone is meant to die in the next 7 years, they reduce that risk by half simply by adopting a healthy lifestyle. And these people are already suffering from this plaque formation. Okay, so what we want you to know is that your genes don't determine your destiny. You can actually do something about your genes or your genetic makeup. Okay, because if these people who are age 44 to 84 were able to do something and decrease their risk of dying in the next 7 years, then it simply means that your genes are not, the ultimate determining factor that you are going to die. Okay. And another reason why people feel like high blood pressure or diabetes or things like this plaque formation runs in their family, or high cholesterol runs in their family, is because they are also passing down eating habits and lifestyle habits down to their kids as well. So your grandparents, the way your grandparents ate is kind of how your parents ate. That's exactly how your parents ate as well. And that's how you are eating. And that's how you're also going to teach your kids to eat. Okay. So instead of saying high blood pressure runs in my family, high blood pressure, high cholesterol, diabetes, all these things are diet and lifestyle diseases. Okay. They are as a result of your diet and lifestyle choices. And the only way to get rid of them is via your diet and lifestyle choices. So it's not really that high blood pressure runs in your family. Okay. It's because as parents, you teach your kids to do what you do, right? Your kids are going to eat how you eat. And because they are eating the way you are eating, chances are that they are also going to suffer from the same diseases that you are suffering from. So it's not really about your genetic makeup. Yes, some people do have that genetic marker, okay, that puts them in the front line, that puts them even more at risk. But majority of the time, it is because of these lifestyle choices that are being passed down. And regardless of your age, if somebody in their 80s are able to reduce their risk of death by half in 7 years, okay, then it means that you are not too old to adopt new habits yourself. Okay. Now, the next myth that people usually say is that, oh, my numbers are good, so I am safe. Okay, my BP is reading 120/80, my cholesterol is 98, my blood sugar is 70. Now, let me tell you a story of this man called Ken. Okay. Now, Ken went to Dr. Mimi, which is one of the doctors that this class is based off their research. He went to her and all his numbers were good. His blood pressure number was good. His cholesterol was good, everything. But he still had heart disease. So the question now is, how would somebody who has a healthy reading suffer from a heart disease? Now, the thing with your readings is that your body works very hard to control your readings, especially your blood sugar. Because if your blood sugar is too high, it can kill you. If your blood sugar is too low, it can also kill you, right? So your body works very, very hard to stabilize all these blood pressures and blood sugars and cholesterol levels. Okay, but your readings are not reliable indicators of good health. Okay, your readings are indicators of your symptoms. Okay, that's what your readings help you to do. Okay, so because your readings are okay, doesn't mean that everything is okay within you. Because if you look back at all the years before you were finally diagnosed as a hypertensive patient or a diabetic patient, you were in the developing stage of high blood pressure and diabetes, but you didn't know. You probably thought that everything was fine with you as well. If you had measured your BP reading or your blood sugar reading back then, let's say 20 years before you were diagnosed with high blood pressure or diabetes, if you had measured it, it would have been normal. Meanwhile, you are actually growing high blood pressure and diabetes, or should I say this plaque formation within you. But your numbers are simply saying that, okay, your symptoms are safe. Your body is working very, very hard to control it. Okay. So because your readings show that you are okay, doesn't necessarily mean that you are okay inside of you. Okay. And again, your readings only show you one aspect of your health, and you are still as sick as your weakest aspect of health. Now, what am I talking about? There are different aspects to your health. You have the nutrition aspect, you have the emotional aspects, you have the physical aspects, you have your mental states, you have your spiritual states. Your readings only show you your nutritional states because it controls your plaque formation. But things like your emotional being, your physical being, your mental being, your spiritual being can actually cause you to develop high blood pressure or diabetes and put you at risk for heart disease. That's why some people, I've worked with hypertensive patients. They are a majority of my audience. Many of them tell me that what caused their high blood pressure is because they lost somebody very close to them. So you can see now that somebody developing high blood pressure is not because of their food. But if you measure your reading, it will show you 120/80. Meanwhile, mentally, you are not okay. And that is what is causing your BP to rise. Okay. And the unfortunate thing is that standard medicine, we focus so much on drugs and surgeries and readings. And we just, instead of focusing on the different aspects of health that make a human being, we are so focused on your reading. When you go to the hospital, all they care about is your reading normal? Is your reading healthy? And even though all those things are true, sometimes a person who developed higher blood pressure due to the loss of a family member doesn't need medication to recover. What that person needs is counseling. But if you go to the clinic and they just check your reading and it's high, they'll just give you medications. And that's how you'll be on medications your whole life. Okay, so because your readings say that you are good doesn't necessarily mean that you are actually okay, because there are other different aspects to your health, and your readings only show you symptom-based, the symptoms, of your overall health, how your symptoms are doing. Okay, so that's also one thing that we have to note. Now, number 3, the third myth that we usually say when it comes to this diet and lifestyle topic is that my medications are enough. Okay, my medications will do it for me. I don't need to do any extra thing. All I need to do is just take my drugs and I'm done for the day, right? Now, the question that you are going to ask yourself is, if somebody who is, for example, hypertensive, is on daily medication, and at the end of the day, they still suffer a stroke and die, what makes you think that your medications are enough for you? Your medications would never be as effective as your lifestyle changes, because as a human being, you are not supposed to take medications every single day of your life. Okay. Now, when you develop things like plaque and your BP is high blood pressure is actually a symptom on its own, right? Is as a result of something. It's not like it's a condition in itself. It's as a result of plaque formation, or it's as a result of your insulin resistance, right? So your medications, what it will do is to just bring down that high reading, just bring down that high blood sugar reading. But it doesn't treat the root cause of the problem, which is this plaque formation we are talking about. And it also doesn't treat the root of the problem for diabetic patients, which is insulin resistance, right? So because it's not treating the root of the problem, you have to keep on treating your symptoms over and over again. And that's why many of us have to take our medications for life. Okay, sorry, my ring lights just went off. Let me try putting it back on, but I will continue the class. Okay, so as your medications lead to side effects, because, as we are taking medications, all medications come with one side effect or the other. As if I suffer from malaria and I take anti-malarial medications, then my tummy would start running me. It's a side effect of anti-malarial drugs for me. So every medication has one side effect or the other. So as you are taking your medications to reduce your symptoms, okay, just to crash your readings, forcefully crash your readings, because your body can no longer maintain a healthy blood pressure or a healthy blood sugar on its own, medications will then forcefully crash it for you. And because you are forcing your body to do something your body cannot do, you are going to suffer for it by experiencing those side effects. And when you start experiencing those side effects, you will now need to go for things like painkillers, to treat side effects of medications. So do you see that it's a constant cycle? And then some medications actually lead to other diseases as well. So cholesterol lowering drugs like atorvastatin, lovastatin, okay, these cholesterol reducing medications, they can increase your risk of becoming a diabetic patient one day. Okay, so your medications are not enough for you. And if you are on medications, you should start thinking about ways that you can, one, reduce your medication so that you can maintain your quality of life, and also get off your medications if you can. Okay, because as your meds are trying to do something, another medication is trying to counter the effects of that medication that you are taking, which in your first medication is not even treating the root cause of the problem. Okay, so the fourth thing is, Rita, if all of these things are important, why doesn't my doctor tell me about it? Okay, why is it that if this diet and lifestyle is so important, why don't I hear anything about it from my doctor? Now, the thing is, diet and lifestyle education are usually left out in medical school. Okay, I'm a medical student. I've gone in 3 years into medical school, and I've only taken one nutrition course. Okay, just one nutrition course. Everything that I know right now from nutrition is based off of research. Okay, now the focus even in that one nutrition course, it's not really about how we can tell our patients to eat well or things like that, but their focus is usually nutrient deficiencies. Because of the way doctors are trained, we have very little to no knowledge on preventive and lifestyle medicine. That's just the standard of medicine for you. Okay, doctors have very, very little time when it comes to seeing patients. So the way we are trained is just, you don't really have the opportunity to have that in-depth relationship with your patients. Okay, so your diet and lifestyle choices are usually the last thing that your doctor will talk about. Okay, and in standard medicine today, we just have to use a one size fits all approach where, okay, your BP is high, take amlodipine. Oh, your blood sugar is high, take this medication, and that's it. Okay, we don't ask questions like, oh, what is causing it? Doctors wouldn't educate you on things like this when you go in for consultations. They don't have the time for that. Okay, and usually we are not taught on preventive medicine, on lifestyle medicine. Okay, so the medical industry is very, very brilliant at treating your symptoms, because we don't make very much money in preventing your disease in the first place. And it can be very, very frustrating because, you would then be a victim of the system and then ignore your diet and lifestyle changes. Okay, so you can take proven steps to help heal your heart and your life, because truly the power is in your hands. Health doesn't come from your doctor or from your drugs or from the operating room, even though we save lives through those means, but health comes from the choices that you make every single day. Okay, and I am bringing this back again so that we can go in depth into these quotes and see how diets, exercise, meditation, and group supports can help you prevent and reverse that plaque formation. And in doing that, you are actually dealing with your hypertension and your diabetes. Okay, so let us look at some of the breakthroughs. Okay, I have categorized these breakthroughs into diets, love and support, and your environment. So let's take a look at some of these choices that you need to make that would really impact your well-being and prevent and reverse heart diseases. Okay, so if I'm telling you that some of the choices you have to make play a huge role, let us take a look at how you can, how you can use these choices, how you can make better choices to impact your well-being. Okay, but before I move forward, I want to get some feedback from you. Are we together? Do we understand everything I'm trying to communicate so far? I would love to get some feedback from you. We are 30 minutes into our class already. So before I proceed, just let me know. Are we together? Do you understand? Am I communicating? Am I also talking too fast? I hope that you can understand me. I hope that I'm not rushing the session. Okay. All right. Thank you for the feedback. So let's look at some of these better choices that we can make. Okay. So the first thing is your omega fatty acids. Okay. Now, the thing with your fatty acids is that you need to get the right ones. They are omega-3s, omega-6s, and omega-9s as well. Okay. Now, each fatty acid is unique. All right. Omega-9s are monosaturated. So you find those in your olive oil, your avocado oil. Okay. And you also have omega-6, which are inflammatory. So you have to consume these ones with caution. Okay. And unfortunately, people consume 4 times more omega-6 than they are supposed to. Okay. And you find omega-6 in your oils, your vegetable oils, your corn oil, your sunflower oil, your canola oil, especially when you reuse the same quantity of oil. That is the same oil you used to fry last week is still the same one you used to fry your Sunday rice stew this afternoon. Okay. Refined foods, processed foods, baked foods, fried foods as well. Okay. So all of these are omega-6s. And then you have your omega-3s, which are the best. And they would also lower your triglycerides, lower your bad cholesterol, and also lower your inflammation. Okay. Now, how can you get these omega-3s? You get them from your flax seeds, you get them from your chia seeds, you get them from your fish, and you also get them from your algae. All right. Now, when it comes to omega-3, there is still a breakdown of omega-3. Okay, we have different classes of omega-3, but I just put them as EPA and DHA. These are the best kinds for your body. Okay, and if you are unable to get this omega-3 from fish, because some people don't like to eat fish, some people feel like fish is unhealthy because the ocean is full of plastic and there are heavy metals in the ocean. People are running away from mercury. What you can do is to get in your supplements EPA and DHA omega-3 fatty acids. Okay, so not just regular omega-3 fatty acids, but EPA and DHA omega-3 fatty acids. Okay, that's the first step. I can't even stress how important this omega-3 is for your health. Okay, because this is simply the basis of cell regeneration. Okay, this is the basis of you building new cells and you getting healthier and you reversing whatever disease you are trying to reverse. Okay, so omega-3 is the first thing you should think about when you want to make a healthier life decision. Okay, now the next thing is vitamins and antioxidants. First off, all your vitamins and minerals are all important. Okay, all vitamins are important to your health. And some of the things that your medications try to treat can be dealt with your nutrition. Okay. For instance, your poor sleeping habits, instead of taking sleeping pills for it, you can boost your calcium, you can boost your magnesium, you can boost your vitamins A, C, D, E, and K. Okay. If we are fatigued and weak all the time, you can boost your iron, boost your vitamin B12. If you're experiencing body pains all the time, instead of taking painkillers, get in some vitamin D. If experiencing sexual dysfunction or erectile dysfunction for men, instead of your first resort being a medication or a drug, why not improve on your zinc intake? Okay, if you're having vision problems as a diabetic patient, why not increase your vitamin A? Okay, so some of the things that you tackle with your drugs, you can first of all tackle with your vitamins and your minerals. Okay, now the next thing when it comes to reversal is your antioxidants, because as a regular human being that wakes up every morning, you go to your 9 to 5 job, 5 a.m. you are awake, you come back. For those of you that stay in Lagos, midnight, 11 p.m., 10 p.m., a lot has happened, okay? And you have been exposed to so many pollutants in your environment. Your antioxidants is what is going to help shield you from whatever free radicals that are trying to destroy your health, okay? Because your body is, so many chemical reactions are going on in your body just to keep you alive. Like you breathing, you getting up, you waking up in the morning, so many chemical reactions have to take place. You digesting your food, so many things are going on within you. Antioxidants help to shield you from all that free radicals that can come out as a result of those chemical reactions that are going on to keep you alive, okay? And they are also the key to reversal of diseases, because they are the first thing that is going to deplete that plaque that is the cause of all your problem, or to reduce that insulin resistance that is the cause of your problem, okay? That is for diabetic patients, all right? Now, if you know that you cannot eat it all, which you actually cannot eat it all, and you don't have time or energy or resources, or you are too old for all of this, then simply get all of your vitamins and antioxidants and your omega-3, get them all in a supplemented form, okay? And you have to make sure that whatever supplements you are getting are naturally sourced for you, okay? Now, let us move on. The next thing you have to take caution of is your red and processed meats. Now, studies show that people who consume red and processed meats have a higher risk of dying earlier. The reason is because there is high salt and sodium content in your red and your processed meats. Processed meats are things like bacon, like your hot dogs that are very popular. Everybody knows hot dogs, right? Very high salt and sodium content, also very high saturated fats. And remember that your cholesterol is one of the big contributors to this plaque formation, right? Red and processed meat also raises your bad cholesterol, and it secretes what we call TMAO. That is something that attacks your guts and your liver, which is even making it difficult for your body to digest food as it's supposed to digest food, okay? And you see, your liver is so important because it helps you with detoxification. And if your liver is damaged, really, it's very difficult getting your body back on track, okay? Your liver is the only thing that can process alcohol. Your liver is also the only thing that can process sugar. So when you are taking things like sugar and alcohol, be cautious that it's only your liver that is carrying all this workload, okay? And that is what detoxifies your entire body system. So you have to be careful. And red and processed meat secretes this TMAO that attacks the liver, okay? So you have to steer clear from red and processed meats, okay? So that you can start making better life choices, all right? Now, number 4 is your oral hygiene. Believe it or not, your mouth has a lot to do with your heart health, okay? Gum disease is very, very bad for your health. And studies show that if you don't floss daily, if you brush only 1 time a day, if you brush for only less than 2 minutes, even in that 1 time that you are brushing per day, you are 3 times more at risk to develop heart disease. The reason is because you can develop gum disease, and the bacteria that is responsible for that gum disease can travel as you are eating your food. It will travel, mix up with your food, get into your blood vessel, and contribute to inflammation and plaque development as you are eating. So studies show that as you floss frequently and you maintain good dental hygiene, you can actually improve your cardiovascular health. And this is actually significant information, and it's also very easy for people to just, throw it off because it doesn't seem like a big deal, but it's actually a big deal because your body works in a synergy, different things aligning. Okay, your body works together. All your systems and organs, they work to complement each other. One cannot do without the other. Okay, so your oral hygiene, surprisingly, is one of the ways that you can prevent yourself from developing heart disease by flossing daily, brush at least 2 times a day, in the morning and at night before you go to bed, and make sure that your brushing time is no less than 2 minutes. If not, you would be 3 times at more risk of developing a heart disease. Okay. Now, when it comes to your heart, people know that you have like a sort of emotional heart, right? And it may sound fictional, but your heart actually has an emotional side to it, even though your heart is an organ in itself, right? Evidence shows that you being angry and hostile all the time can increase your heart disease, can increase your risk of heart disease by 200%. You being angry, quarreling with your wife, quarreling with your kids can actually increase your blood pressure, increase your risk of heart disease by 200%. Okay? And in turn, you being joyful, you experiencing gratitude can reduce your blood pressure and your cholesterol because then you have an emotional heart. Okay? And the things that go on with your emotions and your mental state can manifest itself physically, right? So you having a better emotional health can actually improve your life expectancy. So you have to take actions that support your emotional well-being, because if you are okay emotionally, if you are happy all the time, if you at least you try to not be so angry and hostile all the time, then your blood pressure is going to go down. Your cholesterol is also going to go down. Okay, so it may sound like sort of fictional, but it's true. Okay, the same thing with point number 6. Your love and social support. Your heart is synonymous to love. Okay, when people want to describe love, they draw like this heart stuff, right? Your heart and love say like it kind of represents the same thing, right? So research shows that people with social support recover and survive more after heart surgeries. So let's say someone suffers a heart attack or a heart failure and they have a bypass surgery, and their family comes around and they kind of show love and support. Research actually shows that those people would recover faster. Okay, and they will even survive years after that incident. Okay, as opposed to people who don't have that love and social support. Okay, so the university is Brigham Young University, that shows that people who experience a lack of love and social connection is kind of like you are taking in 50 cigarettes every day. Okay, you're not just having somebody that love, that social connection. It's equivalent to you smoking 15 cigarettes per day. That is wild. And it just shows how important it is for you to be surrounded by love and for you to be surrounded by social connection. Okay, so please try to cultivate loving connections and relationships in your life. Okay, number 7 is stress. And this one, especially for Nigerians, because everybody in Nigeria is stressed out, right? 70% of the time, everybody is stressed out. The economy is not smiling at anybody, right? So many things are going on right now in the country, all right? And research shows that chronic stress is threatening to your heart health. And chronic stress leads to a higher BP, a higher cholesterol, higher inflammation. You will not be able to sleep well because you're constantly thinking. Yes. And you will even suffer a heart attack without even having this plaque formation that we are talking about. So you being highly stressed out or chronically stressed out can lead you to suffering a heart attack without even having the plaque formation in the first place. Okay? The reason is because your body needs attention on the inside. And when you are stressed out, your body is kind of like in fight or flight mode. Okay? Your body is trying, your body thinks that something is trying to, that you are endangered. And so your body's focus is your external environment. So the time and the energy and the attention that your body is supposed to give to its internal organs, that is your liver, to make sure that your heart is doing okay, to make sure that your kidneys are doing fine, its focus is just on the outside. And imagine if you are in that state all the time, okay? So a study in Korea of 107 people, it divided those 7 people into 3 groups. One group, their focus was managing their stress. The other group was just exercise. The other group was conventional care. And the research at the end of the day showed that people in group 1 that practiced stress management, they lowered their risk of suffering a cardiac event by 47%. By cardiac events, I mean a heart failure, a heart attack, okay? Events that have to do with your heart, like a cardiac arrest, all those kinds of things, okay? So like I said, when you are stressed out, your body releases hormones and is giving attention to your outside environment instead of your inside, okay? Instead of your internal environment, okay? So different techniques can help you with your breathing and your meditation. Different techniques can help you manage your stress, such as your meditation, your breathing exercises, your mindfulness, peace, okay, to help you lower your stress and your risk of cardiovascular disease. So I have, I want us to do something right now. It's a breathing technique to help you lower your stress, okay? We call it 4-2-7 breathing technique, okay? So how this works is all of us together, we are going to breathe in for 4 seconds. We are going to hold that breath for 2 seconds, and we are going to breathe out through the mouth for 7 seconds, okay? So we are going to take deep breaths in slowly for 4 seconds, and then we hold it for 2 seconds, and then we breathe out through the mouth for 7 seconds, okay? So I would like us to try this together. And anytime that you are highly stressed out or you feel yourself being anxious, you can simply practice this breathing technique, okay? So let's try it now together. We breathe in for 4 seconds, okay? In. And then we hold that breath for 2 seconds. And then we breathe out through the mouth for 7 seconds, slowly, okay? Now we're going to take it again without me talking, okay? So we breathe in. Okay, and we breathe out for 7 seconds. Now, this would help you relax, and it has actually helped me relax myself. And it's good that you do this before you go to bed, okay? Now, for number 8 is your sleep. Now, studies show that good rest means that you are getting at least 7 hours of sleep every day. And studies show that people who sleep less than 7 hours a day have an increased risk of heart disease and heart failure. So that means that people that suffer heart failures, they don't sleep up to 7 hours a day, okay? And it's not so much so about the hours of your sleep, but the quality of your sleep, okay? So things like you being slightly awake, but you are sleeping at the same time, or you suffering from things like sleep apnea, or you snoring, or you suffering from insomnia, and then you still manage to get by your 7 hours of sleep. Somebody having a better quality of sleep, the both of you are not the same thing. You're not on the same level, okay? So quality of sleep outweighs your hours of sleep, okay? And not getting enough sleep increases your stress hormone. And we've already discussed the dangers of stress, okay? So what are some of the things that we can do to support healthy sleep? All right, so first, reduce your stress throughout the day. Before you go to bed, do your 4-7 breathing exercise. All right, you avoid caffeine, alcohol, and snacks before bed, okay? You lower your screen time and your blue lights from your electronics. All right. You exercise earlier in the day. Create a bedtime routine to remind your body. When I was little, my dad bought Horlicks. We usually take this Horlicks tea. And anytime I take Horlicks, I know that's time for bed. So you can have like a bedtime routine that can remind your body that it's time for you to sleep. Maybe you can pick up a book to read, right? If that is what is going to put you to bed. Or you can have this, I think it's like rain sounds music that people play from time to time, or they have like whale sounds, that will just put you in this peaceful mood that, telling your body that, okay, it's time for sleep. That anytime your body notices that you are performing that activity, your body knows that it's time for you to go to bed. Okay. And you can also create a cool, dark, and quiet atmosphere. And the thing with sleep is that you have to be consistent with your sleeping habits. Okay. Now, number 9 that I have for you is dance. So research shows that dance is actually very good for your heart. Okay, because dance elicits joy and it elicits positive emotions. Your dancing can be intense. It can also be simple. When you dance, you are reducing stress. You are celebrating your life. So try to dance from time to time. Okay, play with your kids. You can even do musical chairs. You gather all the chairs in your house together, and then you play music, and then the first person to sit down, if you are the last person to find a seat, then you are out of the game. Now, obviously, your kids are going to be better than you, but then the point is just for you to play music and dance, because that's actually very, very good for your heart. So dance anywhere, dance inside or outside, dance alone, dance with your friends. Just try to maintain that positive and joyful and happy, outlook of life, because it's going to help your emotional heart. Okay. And sometimes this dance can actually play a part as your exercise routine. Okay. So please dance. I don't know, when was the last time you danced? Have you thought of that? When was the last time you went for a party and, you actually shake your body, loosen out a little bit and enjoy your life, okay? Even though I know Nigeria is so hard and difficult, but dance, okay? And point number 10 that I have for you is progress, not perfection, okay? So with all these points that I have made, from your omega-3s and your vitamins and your antioxidants and your dancing and your stress and your sleeping, all these things I've mentioned, some people are already thinking, this is too much for me. Okay, where am I going to start from? The thing is, you have to start small, because taking action is what is going to build that momentum. Okay. And it's actually a loop of positive events. When you start eating healthy, you feel better. You have more energy. You have more strength for exercise. And when you exercise, you're happy with yourself, right? And when you're happy with yourself, you find out that you are happy throughout that entire day. You are joyful throughout that entire day. And when you are happy and joyful, when you come in contact with people, because you can spread joy and, happiness, you would build positive social connections. When your children want to come and talk to you and they see that mommy and daddy is so happy, then they want to talk to you every time. You are building that social positive connection with your kids, letting them know that they can come to you anytime. Okay, so progress, not perfection. You have to start from somewhere. And this is a lifelong habit that would add years to your life and in turn add life to your years. Okay, so I want to ask you a question. If you followed what I shared with you in the mid section, let go of your limiting belief that your genes is what is causing you to be hypertensive. No, your lifestyle habits and your dietary choices play a very huge role when it comes to you developing, preventing, and reversing diseases. Okay, so let's go of all those myths that you think your age, your medications are enough for you, etc. Okay, and then you follow the breakthrough section. So your diet, number 1, your omega-3s, your vitamins, your antioxidants, stay clear of red meat consumption and keep good oral hygiene. Okay. Number 2, spread love and social support, take care of your emotional heart. Okay. Number 3, decrease your stress by practicing like the breathing technique I shared with you. Prioritize your sleep. Have a sleeping routine. Dance as a form of exercise, okay? And then you start small every day. Do you think that it would be that you would be successful at preventing and reversing this plaque formation? Because everything that we have talked about today, I'm going to go back, is simply, we just broke down this doctor's study, Dr. Dane Ornish and Dr. Mimi. Okay, these are cardiologists, so they know what they are doing. Okay, so what we simply did was to break down these quotes into 10 different subtopics. So do you think that if you follow this pattern, your diet, your oral hygiene, your emotional health, you reduce your stress, you find more time for sleep, prioritize your sleep, and you dance more, you spread joy and positivity, and you also start small, do you believe that it's going to work for you? Do you feel like Dr. Mimi and Dr. Dean are right in their research? I'd love to see your comments in the chat. Okay, I see all your comments, and I'm glad that you agree with them. Okay. So another question for you. How many of you are excited about what we have talked about so far? Because I have talked about a lot, okay? I have talked about a lot. So are you happy with the class so far? Do you feel like you've gained something today? Or do you feel like you are overwhelmed? Do you feel like this is do you feel like this is too much for you? Like, Rita, this is too much. This is too much information. You should have broken this class into 3 different classes. Are you excited or overwhelmed? Okay, so I am checking the time. I'm very time conscious today. So it would be impossible for me to show you everything that you need to get results in a 90-minute presentation. Okay, but I have tried to cover as much as possible. Now, I have a very special package for those of you who want to move forward and you want to implement these 10 breakthroughs that we've talked about today. That is, you want to try this new means of healing yourself via lifestyle medicine, because that's what it is. It's called lifestyle medicine, okay? So is it okay if I spend the next 20, 30 minutes going over this offer that I've created for you so that you can see good and long-term and lasting changes in your health, okay? So I need your permission to move forward if you would like me to spend the remaining time going over the package I have prepared for you. And if you are not okay with it, then we can end the session right here, okay? How many people are going to start brushing 2 times a day now that you know that? Now that you know that your oral hygiene has a lot to play. Hmm? Okay, I see that you are giving me permission. Okay, so let me move forward. Okay, now with everything that we have talked about so far, I have decided to put a 30-day challenge. Okay, so what you are going to get from me is a 30-day challenge that we would go in depth, seriously in depth into this holistic approach to a better health. Okay, We are going to go in depth with your meals. And with your meals, because you cannot eat it well, you have your supplements here. And the truth is, I am very grateful for the wellness supplements, because the exact kind of omega-3 that Dr. Mimi and Dr. Dean talked about, which is EPA and DHA omega-3, is the exact kind that we have in your wellness supplements. Okay. And that is so amazing. And the antioxidants they recommended as well, they had CoQ10, they recommended L-arginine, and astaxanthin surpasses all those antioxidants. So I'm happy that we are on track with the supplements. That is for your meal aspects, okay? But the 30-day challenge is going to cover both your meals, your exercise, your sleep, your stress, your support system, your emotional health, everything that I mentioned in those 10 breakthroughs, okay? So the 30-day challenge covers your supplements, but then you would still need your supplements so that we would have better results, because Dr. Mimi and Dr. Dean recommended supplements, okay? Because the truth is that you cannot eat it all right? So the 30-day challenge would need our supplements. So the supplements are not away from the 30-day class, okay? During the 30-day period, we would need them, okay? So this is what I have for you, this 30-day class. All right, so let us go in depth together into this lifestyle medicine. Let's explore it together, okay? So like I said, we are going to be focusing on your meals. We're going to talk about your diet, your nutrition, your sleep, your stress level. I would give you more stress techniques that you can use to tackle your stress, how you can cultivate better sleep habits. We will dive into sleep apnea and how your breathing plays a role when it comes to your plaque formation, just the way you breathe. Things like how, you being stuck in traffic can be a cause of an increase in high blood pressure, okay? Your emotional state of mind. So the 30-day class is a holistic view, okay, of everything that we have talked about today. And your supplements are in that 30-day challenge, okay? So with your 30-day class that I have prepared for you, we are going to be aiming at a less and reduce dependence on medications and pills, okay? That's the main goal of the class, all right? We are going to be improving our blood sugar, improving our digestion, boosting our immune system, improving our blood pressure, our blood sugar, our cholesterol level, okay? Increasing our energy levels, nourishing our cells better, improving our bowel movements, okay? Cleaning the blood, having a better circulation, even enhancing weight loss, okay? Reducing inflammation, have a happier mood, better sleep. So it's a holistic view of your health, okay? Everything that has to do with you ever falling sick or you ever preventing or reversing heart disease would be included in this 30-day challenge, okay? And with this, you would be able to deplete your plaque formation. You would also reduce your insulin resistance, okay? And you would also get rid of the poor health that comes with you having to take constant and daily medications, and you would get rid of that fear that comes with you being at risk. Some of you are so afraid because you're hypertensive, you feel like you're going to die tomorrow, okay? Let's tackle that fear, okay? And one of the ways to tackle it, I will tell you a story right now. I was reading a book by Dr. Devin DeRose, and he gave an example of his patient who outlived every other patient, that is every other aged patients that he was working with, because this lady was hypertensive. But because she was hypertensive, she just took good care of herself, okay? And in doing that, she was able to outlive people that are in her age group, okay? So she was able to turn this thing that is being noted as a curse, this high blood pressure that is seen as, that is seen as a curse to you, she was able to turn it, to her own benefit, and she was able to outlive people in her age group. Okay, so let us tackle that fear that some of you are always in. You're always afraid that something is going to happen to you. Okay, let's tackle it. So this 30-day class, I would be solving the problem of heart disease and its risk factors for you. Okay, and I am also saving you time thinking of how to implement all that I've shared with you today. Okay, because in the 30-day class, we're going to be walking you through them together. Okay, and I will give you daily simple practices that you can work on every day that would improve your health during those 30 days. So that I actually created this with the mindset that everyone that would participate is a 9-to-5 worker. And I know how people who work 9 to 5 are so busy, right? So I made the practices that we are going to be doing during this 30-day class quite simple so that you don't slip back. Okay, I don't want it to be too difficult for you to implement. Okay, so the whole point of this class is daily simple techniques that you can do that would better your health and improve your health. Okay, so you can also save money on trial and error, giving up too soon, not having someone to guide you through the process. Okay, now, let us see how this challenge and these supplements have helped people, independently. Okay. Now, here we have a Nigerian doctor, Mrs. Dominic. Okay. So she said she ordered 2 for her patients who had pre-diabetes. And we know that people who are diabetic or are suffering from pre-diabetes, they sometimes have poor vision, right? So while he was on the first pack, the blood sugar went down. His blurry vision, which was as a result of the blood sugar, went back to normal. Okay. And she also placed him on a low carb diet with fasting. Okay. So with the supplements and the low carb diet and the intermittent fasting, it's really helped with the diabetes. Okay. So the whole point of this is if we can have just this one aspect of healing using food and dietary practices, okay, in conjunction with the supplements, and we add other things that can also contribute to diabetes, okay, like your stress, your lack of sleep, everything that we've already talked about. You can imagine how much somebody will be able to improve in their health instead of just focusing on the dietary aspect. Okay, that's an editing problem. That's an editing problem. I cannot read Mr. Lacon's review. So let's move on to Ms. Gladys. So she says, good morning. I'd like to share my testimony with you. I received my supplements on Saturday evening and waited 5 hours after taking my blood pressure medications as instructed. The time was 11 p.m., but I couldn't wait till the next day. So I ate an apple and I swallowed the contents of the sachet. My first observation was that I sleep very well. And that's also one of the things, that's one of the importance of having the supplements during the 30-day class, because you are simply accelerating your results. Okay. And she only wakes up from sleep when her son is leaving for work at 6 a.m. Before, she will go to pee at 2 a.m. and that's how she'll be awake all through. Okay. Said, I was elated and this Yoruba song came to mind, meaning we have cause to rejoice because things have worked out the way we prayed. Okay. And she also shared a difference in her blood pressure readings. Okay. And here we have a diabetic patient sharing his review.
So we got to notice that since you started taking Wellness by Oriflame, Wellness by Oriflame for men, that you have seen a lot of changes on your body system. Can we know the issue that you are passing through before you started taking Wellness by Oriflame for men?
You're welcome.
Thank you, sir.
I didn't know about this Oriflame wellness pack for men. I didn't know it from that.
Okay. So how did you get to know about the products?
I was sick for some couple of months back. I was in the hospital for like 1 year and 6 months. I'm an amputee. I lost my right leg to diabetic. When I come back from hospital, I don't know how my wife come across the wellness product. I'm glad that without me, my immune system contributing giving me strength to operate. As one who is learning on how to use the process that I'm using now. That which I mean. So because she wanted me to go into using the products, she had to register as
A member.
of one of the marketers or a vendor. So she registered so that to help her
Get the products.
procure the product for me at any time I need it.
Yeah.
So she began using it. I really saw a great of improvement in my system. Was besides the complication, I had some other problems. Like I had a problem on my neck and this right arm. I had a spinal problem that affected my neck and my shoulder. I didn't get up the joint, the split bones on my shoulder, but I couldn't raise the right hand. I was not using it to do anything again. It was a difficult problem for me. It was very difficult for me to
Hold your palms.
hold my palms, to form a fist like this. I was not even writing again with my right hand. It was a serious problem for me to sign my signature again with the right hand. But since I began to use the
Wellness pack.
I got some level of relief, and I can now fold my arms. I can hold things and hold it firmly.
Chai.
And now can raise my hand. I also write and can sign my signature.
Wow. Oh.
All right, so I'm going to pause there because of time. But what I'm trying to communicate with you is if you can have such results with the pack independently, under your 30 days wellness challenge or the course, whatever we want to call it, we are now going to see ways that we can improve our blood sugar so that when we don't even have the pack, we can continue in that treatment that we have already started. Okay, so I have still lots and lots and lots of reviews to share with you.
5 days of taking Oriflame
Well, but
yes,
because of time,
this is unimaginable. Wow, I'm so grateful to Jehovah for the gift of Oriflame Wellness. I advise everyone, please, if you are currently using glasses, I'm not saying you should throw your glasses away, but all I'm seeing now is like a miracle. With this product that I just started using, now I can read the prints. In fact, they appear bold to me.
okay. So because of time, I wouldn't be able to take you through all the reviews that I plan to share with you. Okay, but I hope that we get the gist of what I'm trying to communicate with you. So with the pack and your 30-day challenge, you now have a broad approach that would focus on your cause of plaque formation, and we will tackle it together. We'll go in depth into the situation that applies to you, so that for those of you that have hypertension or high blood sugar, not because of plaque formation, but because of things like your emotional state or your stress level, we would be able to tackle those things as well. Okay. Now, a common, or should I say, what I know some people may be thinking is, how can I be sure that this is going to work for me? Well, I have put in a lot of research time to this, okay? I have read a lot of books written by doctors, by cardiologists, by doctors who practice lifestyle medicine, okay, before I decided to condense everything that I have learned into a 30-day plan for you, okay? So I have put in a lot of research and time into this, and I know that this is the current and the safest way. And this time around, we are not just focusing on your diet and nutrition with the supplements, but other things that can play a role, okay, when it comes to you getting better at your health, okay? So I have done my part. I have invested even my money to understand how best, I can guarantee you results in this 30-day journey. So I have made it simple for you, and all you have to do is to get on board. All right. So here's what you're going to get. The first is your supplements, which take care of these first three things. And then you have your meal plan that would help you in your 30-day course. Okay. And then you have the course itself. Now, everything together is valued at $107,990. Now, obviously, I'm not going to charge you $107,990. Okay. But if I did charge you $107K, and all it did was to help you stabilize your blood pressure, your blood sugar, take care of your health, take care of all the fears of stroke, heart failure, depleting your plaque, etc. And the beautiful thing about this 30-day challenge is that you will be able to continue with the practices even after the class is over. Okay, so for those of you who want to go with it long term, it's not a recurring class. Okay, when you go through it once, then you can simply continue those practices yourself, because everything I'll be sharing with you are natural and free and simple techniques, okay, that you can implement in your day-to-day life as a 9-to-5 worker. Okay, so I am not charging you $107K, but if I did charge you, do you think that it would be worth it for you to go through this class? I would love to see your comments in the chat. So I am not charging you this amount, but if I did charge you and you went through the class and you got good results, do you think that it would be worth it? I would like to know. I would like to hear from you. So I am not charging you over 107,000, but if I did charge you, do you think that it would be worth it if you go through the class and you got good results with it? Okay. Okay, I see your comments. Thank you. All right, so I've had two choices to make: to go as cheap as possible and to sell many packs and to sell many entries into the 30-day challenge, or I can demand a higher investment in your health from you and play my part. Okay, so here is my free gift for you. Okay, here's my free gift for you. I want you to choose your package. This is the simplest I can get it down, okay, for you. All right, so offer one, 83,400. You have two supplements. So let's say you want you and your wife to go on this journey together. So you get two supplements, or you get two supplements for yourself, okay? I will give you a free delivery. And by buying two of the supplements, you save 10,600, okay? You also have your free meal plan that will be granted to you, and you have free access into the 30-day course. Okay, so in total, with this first package, you are saving 30,590. Okay, now here is offer two. You get only your supplements that are worth 46,990. So one pack, you have a free delivery, you have a free meal plan, and you also have free access to the 30-day plan just by purchasing your pack. Okay, and with this, you are saving 19,990. Okay, or you can skip the supplements, okay, and just get into the class itself. All right, so your entry fee into the 30-day class is 19,990, and we need to have a free meal plan to come along with it, and you are saving 5,000 on that meal plan. Okay, so let me go over the offers again. When you are purchasing two, it's worth 83,400. And in total, you are saving $35.90. All right. So when you purchase two, if you'd like to get two for yourself or two for your wife, you just purchasing the pack grants you an automatic free access into the 30-day plan. Okay. And your free delivery and your free meal plan, everything comes along with it. If you are just getting one at $46,990, you still have your free delivery, you still have your free meal plan, and you still get a free access to the 30-day plan. All right. Or you just want to get access to the challenge itself. You just want to get access to the 30-day challenge itself. You know, you just have your free meal plan. You pay the entry fee of $19,990 and you are in. Okay. All right. So at this junction, I would love to get some questions from you. So now is your opportunity to ask me all the questions that you would like to ask me. Okay. So is this a drug? Wellness is not a drug. The supplements are simply supplements. Okay. If you are pregnant or breastfeeding, I would recommend that you take the supplement. So if you are pregnant or breastfeeding, you can just gain entry into the class, but I would not recommend that you actually buy the supplements and take them, okay? Until you are done breastfeeding, you know, your baby, okay? How long will I take it? / how many packs do I need? Now, because wellness is a daily supplement, you can take it for as long as your heart wishes to take it for, okay? But for this class, this 30-day class, the supplements are 21 in a pack. So it would last you for only 21 days, okay? So for those people that would like to get to so that it last them all through the 30 days, no problem. For those people who just want to get one for the 21 days, no problem, okay? How long does delivery take? Delivery usually takes 3 to 5 working days, okay? Delivery takes 3 to 5 working days for your supplements. And for your payment options, the only payment option we have is your payments before delivery, okay? And I know that some people are just joining me for the first time, while other people have been with me for a few months now. So those people don't have an objection when it comes to free delivery because they know already on the group. I try to be transparent and accountable with your deliveries, okay? So for those of you that are just joining me for the first time, I want to assure you that if you do make payments for your supplements, you would receive your products, okay? And here's just one of my groups. Mrs. Elizabeth, thank you, Rita. My package was delivered yesterday. I made payments on Monday. Thank you once more. Okay, so for those of you who have been with me for a while, you can also testify to this payment on delivery, payment before delivery thing, okay? To give the new people sort of confidence, okay? If you would like to anyway. Yes, so that is all. So I would love questions now. Please let me have your questions. And if you don't have questions, we are done for the day. Okay, so I actually would like to start our 30-day challenge in November, okay? Because I have some new entries and I want to give everybody enough time to think this through, okay? To think this through and commit to the process. So I am leaving the slots open up until the 31st of October, and we can all get started together on the 1st, okay? On the 1st of November. All right, so when you choose your package, you can please take down my number. That's very important so that you can contact me later on, okay? All right, I see some questions. What can be the cause of my case? My BP is normal, but one part of my body is disturbed since yesterday. How often do you experience this pain? Are you on antihypertensive medications? And how intense is this pain? Okay, I feel sharp pain in the upper left-hand side. Can you tell me what precedes this pain? So what usually happens when you start having this pain? And also, please tell me if you are on antihypertensive medications. So while I'm waiting for your response, Busuyi, I will take other questions, okay? Any drugs? I don't recommend drugs, please, okay? You have to see a medical doctor for drugs or diet for LVH. Can you tell me what you mean by LVH? Because LVH can mean left ventricular hypertrophy. Is that what you are referring to? Basically, the left ventricle of your heart is thick and enlarged. Is that what you are referring to, ma? Okay, since it has to do with the heart, this 30-day challenge will be focusing on the heart as well. Okay, so it would help you. I don't have drugs for that. Okay, the supplements and your 30-day challenge would be able to help you reduce that thickness and enlargement. Okay, amlodipine for your hypertension. Okay. Can one's heart beating faster than usual? Sometimes when I take breakfast. Okay, do you mean heart palpitations? Heart palpitations are not dangerous. Okay, neither are they harmful to your health. Okay, so for hypertensive patients, they are really common, but they are not dangerous to your health, except when you have them and you also experience chest discomforts. And when they are lasting longer than usual and when they are very severe, then that's when it can be a problem. Okay, but heart palpitation in itself is not dangerous or harmful to you. You are just simply aware of your own heartbeats. Okay? Not hypertensive, not diabetic, though with high bad cholesterol, and diagnosed with hypothyroidism and on levothyroxine. Why the cholesterol? Well, cholesterol can be due to a lot of things. Okay. First, it can be in your genetic makeup, and the other part is via your lifestyle, okay, and your dietary choices. And cholesterol is actually one of the easiest things for you to get down, okay? It's better, and it's easier for you to get your cholesterol down with a few practices than to get your blood sugar down, okay? So the cause of your cholesterol can be due to multiple things, okay? I'm on medication, but not heart drug or BP drug. I'm on back pain drug. Okay. Okay. Busuyi, yes. Mr. or Mrs. Busuyi. So let me scroll back to your first question. I'm looking for the first part of your question. Okay, I've seen it. All right, so you said you are simply on back pain medication. Okay, the thing with pains is that pains can travel. So for instance, if someone is dealing with a heart disease, or if someone is dealing with chest pain can also travel. So it would be difficult for me to, should I use the word, diagnose the reason for this sharp pain that you are feeling at your, I think your left hand side, right? So have you been to the clinic for this sharp pain if it's unbearable for you? Since you are on medications, but it's not a heart or a BP drug. Okay, so just back pain. Yes. Have you been to the clinic for this pain? Because it would be very difficult for me to diagnose this sharp pain, because it can be due to so many different things, honestly. Okay, intermittent fasting is simply eating, it's like spreading your eating times. Okay, so intermittent fasting is just like regular fasting, but then you are controlling your eating time. So there are different ways to fast intermittently. You have the kind of fast where you eat for 8 hours and you fast 16 hours, or you eat for 16 hours, not like you are eating for every single hour, okay? But your eating times last, or should I say range over a 16-hour period, okay? And then you are fasting for 8 hours, okay? So I can have my first meal by, say, 12 p.m., have my next meal by, let's say, 6 p.m., okay? And then the rest of the entire hours, I would be fasting during those periods, okay? I would be in fat burning mode during those hours. So intermittent fasting is you are simply fasting, but then you are fasting at different times of the day, okay? Or people fast intermittently by controlling their portions. People also fast by eating one day and then fasting throughout the entire next day, okay? Other people, they just control their calories, okay? So intermittent fasting is simply fasting, but then at different points in different hours, different times in your day, okay? Or in your week. Some people even do, you eat 5 times a week, you fast 2 days a week, okay? So there are different methods to it. It's simply fasting, but at different periods and times, okay? Okay, Mrs. Naomi, what about feeling a kind of heaviness on your left chest? Is it due to this palpitation as well? If you are having palpitations and you feel like your heart is heavy at the same time, and you are also having that chest discomfort, or you are experiencing chest pain, is what visiting your doctor for, okay? However, your palpitations on their own are not harmful or dangerous. But when they come along with side effects like chest pain or chest discomfort and things like shortness of breath, and you are feeling nauseous, then it's something worth visiting your doctor for. Okay. Okay. Mrs. Samuel says, can the diet cure acid reflux? The diet, I don't have a diet plan for acidic reflux. Okay. And the supplements for acid reflux, it's a very, very, very gradual process. You have to be very, very patient with it. Okay. When it comes to acid reflux. So in the long run, certain vitamins that are contained in the pack would be able to support your treatment, okay? But I wouldn't regard it as the cure, all right, so that reflux, okay? And currently, I don't have a diet plan that targets this acidic reflux, not at this point in time. Okay. A serious condition, your heart palpitation. Heart palpitation in itself is not a serious condition, but when it's accompanied with chest pain, feeling nauseous, etc., then it's a problem. Okay. You feeling like you cannot breathe, then it's a problem. Then it's something worth seeing your doctor for. Okay. If that's what you are referring to, Mrs. Naomi. Okay, I'm waiting for more questions, and if I don't get any, I would end the session. Okay, sorry, I'm just saying your question, Mr. Peter. All right. For your aorta knock-on, medications and or surgery would be the best to help you. Okay, that would be the best to help you. In as much as your diet and lifestyle techniques would play a role, especially in your treatments, the first line of defense would have to be your medications and or surgery. Okay, but your high cholesterol, I can help with that. Okay. Okay, I'm still waiting for questions to know if I can. Okay. What's the help for high cholesterol? So with high cholesterol, first we'll have to start with your diet. So we have to replace your saturated fats with your healthy fats, your omega-3s, and we also need to increase your fiber foods, okay? That will sort of absorb that cholesterol out of your bloodstream, all right? So things like your oatmeal, your kidney beans, your cabbages, your pears, they would be able to help you. Okay. And also your vitamins like vitamin K2 will be able to help you with your cholesterol as well. Okay. So when it comes to high cholesterol, the first thing you need to do is a diet modification. And then you tackle other things like your exercise that can help to deplete your plaque. Okay. And Mr. Peter, can medication take care of that knuckle? Yes, yes, it can. Medication would be able to help you with that. However, sometimes if the drug that your doctor recommends to you doesn't work as fast as it should, because what's really happening to you is that your aorta is blocked. Okay. And that's a very, very important blood vessel that supplies blood to every other part of your body. Okay. So if the medications are not working in time, then they may have to give you an aortic valve replacement surgery. Okay. That would be able to help with that. And I see your next question. What kind of medication? I'm sorry, I cannot recommend medications to you at this time. Okay. So I can only help you with your diet and lifestyle choices, and I can also help you with some supplements, but I cannot give you or ask you to take any medications at this time. You would have to see your doctor for that, your primary care doctor for that. Okay. All right. Any more questions? You're welcome, sir. All right. Any more questions? Thank you. Thank you so much for joining me live and for listening to me. God bless you too. All right. So I will be logging off now because, okay. No, they are not the same thing now, Mrs. Esther. They are different. They are not the same as the one you find in your pharmacy. Sure, you can send me the results of the test if you'd like to hear my own opinion or see how I can help you more after this class. There's no problem, sir. So you can see my number right here. That's my WhatsApp number, okay? But I will not be responding to WhatsApp messages right now because after this class, I am very tired. So I'll get to it first thing tomorrow morning, okay? Yes, the session is recorded. I would upload it to YouTube after we are done and you can have your replay, okay? Okay, any more questions? Okay, so if there are no more questions, that would be all for tonight. Okay. So thank you so much, everyone, for joining me live. I will talk to you at a later time. Okay. And you can always reach out to me via email, or you can take down my number. Okay. So let me put my number now in the chat so that you can text me on WhatsApp or give me a call. Okay. All right. So take care, everyone. Good night.